Hello and welcome to the Belfast Health and Social Care Trust Department of Rheumatology. We're part of a large department here and we've got 6 consultant rheumatologists and 6 nurse specialists. We work across sites, so what that means for you is when you're referred into us, you might actually get an appointment to be seen at outpatients at Belfast City Hospital, Royal Victoria Hospital or even Musgrave Park Hospital. We also have a big busy inpatient unit at Musgrave Park Hospital. We work as part of a large multidisciplinary team, so not only are there doctors and nurses, but there are physiotherapists, occupational therapists, dietitians, pharmacists, radiologists, orthopaedic surgeons, and we're supported by a huge admin team. So you might ask, what type of patients do we see here at rheumatology? And it's not just arthritis patients. There are more than 200 joint, bone and muscle problems that we can help diagnose and help manage. Interestingly, about 1 in 3 people who attend their GP do so because they've got a problem with their joint, muscle or bone, and we can try and help with all of these things. To kind of keep it simple, we look after the medical management of people with muscle, joint and bone problems. We work very closely with our orthopaedic colleagues who deal more with the surgical side of joint problems. We look after wear and tear arthritis or osteoarthritis. We see a lot of patients with fibromyalgia. We also look after people with inflammatory arthritis that you might have heard of before, things like rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis. And then some rarer things which you may not have heard of, things like vasculitis, connective tissue disease, things including lupus and scleroderma. So what's going to happen to you when you come up to the rheumatology department? Well, to start off with, we'll have a good chat to you, what's been going on, ask you about your symptoms and how things have changed. We're then likely to examine you. We might look at your joints, your bone and your muscles. And then we'll do a scan of your joints on many occasions. This helps us to look deep inside the joint to see if there's any evidence of inflammation or damage to the joint. Many patients need blood tests and x-rays. Your GP may have organised these before you come to see us, but we can request these on the day. These will help us to work out exactly what's going on. We then put all the information that we've got from chatting to you, from examining you, from the tests you might have done, to decide what's going on to make your diagnosis. Interestingly, most patients referred into a rheumatology service have osteoarthritis or fibromyalgia. Very few patients have inflammatory arthritis that require further follow-up from rheumatology doctors and nurses in the long term. So what happens after that? We will take some time chatting through your diagnosis and we'll also give you some written information on your diagnosis. We'll chat to you what your prognosis is, and that means what's going to happen to you in the longer term, what's the long-term outcome of this condition. And of course, importantly, we'll chat to you about how to manage your pain and your stiffness. It's really important that we get a chance to tailor-make a management plan specifically for you because every patient is different. It will certainly include pain management, and that might include tablets, topical rubs, maybe even in some occasions injections. But there's lots of other important things that we have to think about when you have pain and stiffness in your joints and muscles. And these might include looking at your diet, encouraging weight loss, helping you to stop smoking, and also a very important thing is helping you to improve your sleep. It's also very likely that we will have to get some of our colleagues to see you. These might include a physiotherapist, an occupational therapist. Sometimes we refer you on to versus arthritis, or you may need to see some of our other specialists that we work alongside. Through it all, we liaise very closely with your GP to let them know what we think and what needs to happen next. If you would like some further information, please join us in some of our virtual information sessions, or please feel free to contact Versus Arthritis.